Medical Dilemma.
Welcome back to Medical Dilemma. Again, we would like to say thank you to our major sponsors, St. Clair's Medical Center and LifeQuest Training and Consultancy Corporation. Now, at the start of this third segment of our show, I'd like to open with the question of the typical perception of Filipinos. Whenever somebody would consult with a psychiatrist, Filipinos would see that person as someone who's crazy or siraulo in the vernacular. How do we handle this? How do we change this?
I hope I know the answer to that, Sonny. You know, that's
Well, it's a question open to everybody.
Maybe more education
Definitely.
to the public.
Psychoeducation, kasi nga there's this stigma that you go to a psychiatrist and you're crazy, parang siraulo ka, kaya ano. So a lot of people who need help really do not go to seek help just because they don't even want to be seen outside of our clinics,
Exactly,
So I think the
yes.
best talaga really would be shows like this wherein, you would educate the public that, depression is a medical illness just like diabetes or hypertension. It's nothing to be ashamed of,
Yes, and I think an
baliktad.
offshoot of this perception is the many cases of people who are abandoned in the streets because they have like, mental problems.
That's not depression, That's not depression.
Yeah, I know. But I've encountered a couple who started out as depressive, but the family didn't know what to do with them, so they just abandoned them. And I guess it progressed into something more severe. I'm not sure. I'm not sure though.
Depression will not like convert into let's
Psychiatric
say
problem
like psychosis or ano. Although sometimes if the depression is really severe enough, we can have like psychotic symptoms, but then treat the depression and the psychotic symptoms will go away.
So it's really very treatable, right?
Yes, around maybe we were talking like around 70% would respond
70%
to medications. Sometimes there's certain percentage that's what we call like treatment resistant, but you don't usually say that unless you've tried like several treatment modalities.
And it will
It's
take
highly
time.
treatable, definitely.
Highly treatable. In the States, ano pa nga hindi yan stigma, glamorous pa nga, a little feeling depressed lang, consulta ka agad. And they all brag about it,
And the tendency is
because
people,
they can afford.
people handle you with a kid's glove if they know that you're depressed ba in this parang ganun, parang they're more careful around you and they're more somehow supportive, ganun. Dito kasi sabi nga ni Sunny, iba yung connotation. Although as you said, Doctora, there's a difference. It's not clinical depression is different from psychosis, etc., etc. So, well, we do not distinguish, no? Ako in my annulment cases, I refer my clients to psychologists or psychiatrists. Ayaw nila pumunta doon nang hindi ko sila kasama. Kasi sabi, attorney, ayoko pumunta sa clinic na yun kasi may nakalagay, psychiatry. Ganyan. So, kasama ko para alam nila na, legal or whatever, annulment, gano'n. So, yung psychiatrist sa kanala ko has stopped putting a sign outside this, walang marker outside this clinic. It's just a door with a number.
Good idea.
Just maganda rin, di ba, Doktora?
Yeah. That's what we, like yung, para kasi nga may minsan nagkakastigma, like pag sa infectious disease, psychiatrist,
Baka kala HIV.
Kaya sa lahat ng papansin nyo, wala na nakasulat.
Tama, that's a good idea.
Okay, so it's to lessen the discomfort of people that are consulting.
So, very treatable yan. So that's the main difference between a psychiatric patient na psychosis and one depressed.
Not really.
Depressed is treatable. Psychosis, you're not sure.
Well, actually, psychosis also is just a symptom. Again, just like depression, you can have psychosis secondary, let's say, to some medical condition. You can have psychosis as a primary diagnosis. Maraming differential diagnosis for psychosis.
It can be part also of a disease.
And it's manageable by medications also, psychosis.
I see. Yeah. So they can live ordinary lives also, regular activities.
Sometimes depends on the patient. Sometimes we have patients who like recover and they live like and then sometimes kasi they learn to live with the symptoms. So they expect lang a certain.
May naririnig na boses minsan.
May naririnig. O sige, pero pag alam kong boses yun and it's really not real, I can go about doing whatever I'm doing.
But medication is very
Oh,
important,
definitely. Medications is a big part of it.
Doctor, you said kanina na change in sleeping patterns, for example, and then that affects performance can be an indication of clinical depression. Yes, one of the symptoms you said. how do you distinguish that from talagang tamad lang yung tao, yung talagang ayaw pumasok, walang ganong...
Menopausic lang.
Ano,
Something like that.
yung paano ba yun? Kasi it's an excuse eh. People think like, I have friends who say on Facebook na they're depressed, they don't want to go to work anymore. Then parang iniisip ko, hindi kaya, maybe they should just change careers or they should change offices or ano. So,
burnout lang sa work.
burnout, di ba?
Probably somebody who is lazy has been lazy even before.
Exactly. You look at the whole, the longitudinal picture.
Yung naging trait na, no,
Pero
kunwari
kunwari kapag yung bigla na lang, na parang
Yes.
ayaw na lang, tapos 2 weeks ago, 1 month ago, biglang nagkaganon. Then,
iba,
Yeah.
that's when it should be a red flag.
I don't know if this is also some sort of an indication of a depression in which I have a colleague. Well, that's the same with me.
Okay.
Well, suddenly he would just stay long, very long in the bathroom. Because whenever he's out, if he sees people, let's say, putting their finger into their nose,
it
he would
means
always believe
something.
that
Mabaho
he smells.
Sometimes,
Something like that. So he would stay long and put so much perfume, etc.
Ay, Father, kasi sometimes kapag medyo deep depression, it can lead to parang mga ganun, parang paranoia, like they feel that they're referring to
Right,
him.
I think it's already a paranoia to the point that the person is very has a lot of suspicions when people
Definitely, magko-consult na
And
dapat tingnan,
of course we
Father,
are worried.
Oo.
We are worried. But before he was so well, he was into the intellectual life. He was very active. Suddenly, he does not have any interest in those activities, etc. He's low down. He's tired,
Yeah,
etc.
oo.
So, well, of course,
Yes, that
we
can-
have learned that he was depressed.
Oo, yeah, I
What
think
age
that
is
really-
that, Father? Was he? Or is he?
Around when he was 58, 59.
That
medyo
age.
ano
So,
na,
no?
what
Late-
is
a
the
little
common
bit late, or
age
Pag
for
medyo
this?
later
Meron ba?
onset yung depression, then again, we always want to rule out any medical basis. So definitely, may mga tests na papagawa yan. Only when pag nag-clear yan sa mga tests that we would assume it's depression, as in clinical major depression.
Is there any biological change in the brain or what, doctor? Or something like that?
There would be like chemical changes. Yes, there are some changes in the brain, but it's not really very conclusive, not like, like with other illnesses. Kung pag nagka-stroke ka, although pag stroke ka, talaga can cause depression
No
also.
stroke, no nothing.
Yun
for
nga
that
pag
matter.
ganun, there's no very clear na talagang changes in the brain that would indicate depression, nor is there any laboratory test that would indicate depression. It's usually a diagnosis through the history of the patient.
Behavioral, no, doctor. Although there can be chemical, as you said, indications, changes in the brain.
Attorney, I'd like to go back to the workplace situation, yung kaninang may performance evaluation. Supposing a person is terminated because of poor performance, and it so happened that that person is suffering from depression, could the employee go back and defend himself on that ground, and then maybe make a promise na I won't repeat my poor performance again because I'm now on medication?
Okay, it depends on the employment contract between the employer and the employee. Although there are some instances when, especially if you are employing artists and your company is very dependent on these creative minds, that you can excuse psychological illnesses and or temporary episodes of such, and support them in maybe a rehabilitation program, or let them go on vacation for a short time. There are instances like that, but not all employment scenarios will be like that. So if it's performance based, walang salary, commission lang, then it doesn't matter kahit hindi ka pumasok the whole month.
Okay
Basta
lang.
you deliver
Yes,
client
as long as you
sales.
deliver
Yes,
the
oo. So you have real estate agents, for example, ganyan ang basis niyan. Ngayon, kung ang basis is attendance, gano'n. So you have to come in 8 to 5 every day for 20 days a month. Regardless of what's going on inside you or in your family, etc. If you're always absent for prolonged periods of time, then the employer has the right to terminate you. it can also fall under illness. So if it's a chronic illness, pero dapat kasi nakakahawa para i-terminate validly ng employer. Like
The labor law grounds on termination
Yes,
for illness.
yes, but it cannot be considered as such because it's in the brain, it's in the mind. So it's not nakakahawa. So it's not a danger to the workplace. So
In
to
some
speak.
ways, nakakahawa rin siguro.
Yung lagi absent to, ako rin,
Well,
parang
well,
gano'n.
Yeah. But probably
So, absenteeism.
we might also disrupt the environment, and that could be a cause. So probably the employer should should do something about it.
Yes.
And probably put him in an environment in which, he'll not be able to affect so much other people, and that he can work by himself alone.
Siguro mas magandang threat yan. Sasabihin mo, pag laging absent, we have to consult a psychiatrist. Takot lang nila.
Okay, so using it as a defense, except if it's stated in the contract, is not a very strong ground.
Oh, no, it doesn't. In terms of whether justifying that you're illegally dismissed, for example, and to claim back wages, etc., or
Yes.
to claim back separation pay and to be reinstated in your work, no, it's not a very strong
very
ground
strong
and we have very few cases na yan yung ina-allege ng employee.
Really?
Yeah, so
So that's where the certificate from a psychiatrist would probably come in and save
yes,
the day for him. Diba?
And in fact,
Kung may
maybe
cases.
if as early as the hiring process, that when the potential employee already discloses that he or she is probably suffering from clinical depression and this might affect his work performance, and then the employer decides to hire this person nevertheless, then the employer cannot just, illegally dismiss the employee.
Because he knew beforehand, right?
I see.
What if the employer, what
Yes,
if the
Dr. Ara.
employer dismiss the employee because you have depression, parang discriminated against the employee because of the illness? Would the employee have like valid grounds for?
It's possible.
Yes, it's possible that that is a case of illegal dismissal or invalid dismissal.
But that could be very complicated. And probably the employee will say, "Who says that I'm depressed? Who told you that I'm depressed? I have not gone to a psychiatrist. I have not done this or done that. Who says that I'm depressed? It just so happens that probably this is the way that I behave." So
Talagang-
sometimes it becomes complicated
Then
also.
there will be a basis to terminate him.
Right. Other basis probably if it becomes disruptive. And
Can you compel an employee to seek psychiatric help? Or at least a psychiatric consultation?
Yes. I would think it's like when an employee forces to go to work even though he's coughing and talagang masama yung
So the
Oo,
employer has
nakakahawa.
the right,
Yeah, so you
to,
are encouraged rather, but to compel,
encourage,
yeah,
compelled.
to compel. Well, it's part of the rights of the employee. Yung as I said, there are sick leaves, vacation leaves,
Yes.
etc. And you should support their health, whether mental or physical. So
Yeah,
yes, an employer has the duty to encourage. I think I wouldn't say compel an employee to go seek psychiatric
And
help.
yeah, that's correct, no? That's correct.
Okay, well, we've reached the end of our show. So, Dr. Gochu, do you have any parting words for our audience?
Depression is an illness, it's not a weakness of character, it's not nag-iinarte lang, So if somebody has depression, please have, bring your loved ones to seek treatment because it's a very treatable condition and, it will definitely improve the state of your loved ones.
Okay, thank you so much, Dr. Gochu.
Thank you.
Attorney Sara?
Yeah, I'd like to reiterate what Dr. Gochu said, that any form of mental illness or disorder that one is feeling, consult your doctor. It's always best to seek professional help.
Okay, thank you. Father Jerry?
well, everybody experiences illness in whatever form it is.
Once in a while we
And
do.
Once in a while, sometimes become also misbehaving, etc., whatever the cause will be. The fact is that we need people who will take care of us. We need you need us, we need everyone else, because we belong to each other, we are bonded by our common humanity.
Okay, and Dr.
And I
Sanchez?
think the family is the first one to give support to such people, and therefore we advise the parents even and the next of kin, whoever we are with that patient, to really be observant. If there's really something untoward or out of different from his behavior, whether it's due to drugs or depression, dapat i-advise, no? And seek consult.
Okay, thank you so much, everybody. C.S. Lewis, author of The Problem of Pain, wrote, "Mental pain is less dramatic than physical pain, but it is more common and also more hard to bear. It is easier to say, 'My tooth is aching,' than to say, 'My heart is broken.' We hope that increased awareness of depressive illnesses will encourage those who suffer from them to seek treatment." Thank you for watching this episode of Medical Dilemma. Watch us again next Sunday at 6 p.m. here on GNN. You can also catch us every Monday from 11 a.m. to 12 noon on this same channel. Help patients and families in crisis. Be aware and show you care. Have a productive week ahead.
Medical Dilemma